Erika Barth Cottrell, class of 1995, could be a poster child for the power of the liberal arts. She graduated with a major in anthropology, earned a master's in public policy at Harvard, and received her PhD in sociology and demography from University of Wisconsin-Madison. Prior to her current focus on public health and health systems research, she worked on arms control and the international security for the Union of Concerned Scientists, and on global HIV/AIDS programs in the U.S. Department of State and U.S. Agency for International Development. And that liberal arts education, she believes, has contributed significantly to the way she applies theory to practice, draws from multiple fields and integrative research in search of new solutions to healthcare problems, and focuses on creating robust systems designed to support those in need of healthcare. Erika currently has a joint appointment as Associate Professor in the School of Medicine at Oregon Health and Science University, and Senior Investigator and Director of Clinical Research Networks at OCHAN, a national network of community-based health centers. Her research focuses on the non-medical factors that shape inequalities in health outcomes, including, for example, the impact of changes to federal and state health and social policies on healthcare access, the role of community-level social, economic, and environmental factors on health outcomes, and the impact of interventions to improve the delivery of healthcare in rural and lower resource settings. Erika's blend of traditional quantitative research and innovative qualitative studies, which collect the stories of individual patients, often put her at the cutting edge of her field. In 2014, Erika joined a small but dedicated group of researchers to launch the Health Experiences Research Network, the U.S. chapter of an international network of researchers and healthcare providers intent on better understanding people's experiences of health and illness. As part of the work, she has interviewed hundreds of people about their experiences with specific health conditions, including veterans with traumatic brain injuries, recovering opioid addicts, and families with children who have had cancer. She uses these narrative accounts to illustrate the human elements of population-level findings and as a tool to facilitate the translation of research into policy and clinical practice. Her research, which has been funded by nearly 25 federal and foundation grants, is deeply embedded in scholarly disciplines, but always has the goal of learning how practitioners can use that knowledge to better the lives of real individual people. That research, which draws from multiple disciplines and works at local, state, national, and international levels, has resulted in 73 peer-reviewed publications and numerous invited lectures and presentations. Erika's collaborative work, applying empirical knowledge to the real world, is at the core of Luther's commitment to use the liberating power of knowledge to prepare students to serve with distinction for the common good. For bringing to life Luther's core values of community, excellence, and curiosity, Luther College is proud to recognize Erika Barth Cottrell with the 2025 Distinguished Service Award.